President Trump, in his address to the Congress just a few days ago, reiterated his commitment to step-by-step health care reforms to expand choice, to increase access, to lower cost, and at the same time, according to President Trump, we're going to do everything to provide better health care. I was encouraged that he decided to back the expansion of health savings accounts. That allows everybody in the country to put more of their pre-tax dollars into portable health savings accounts that go with you wherever you go, from job to job. You've still got that health savings account. And the plan that the House of Representatives is debating right now really expands the way you can use that health savings account, as well as expands how much money you can put into that account. Most importantly, the president reaffirmed the need to ensure coverage for all pre-existing conditions. I've always supported providing insurance options for people that have pre-existing conditions. I've sponsored in the House the legislation that allowed young people to stay on their parents' health care until they were 25. The people drafting the Affordable Care Act put exactly that language in the bill and raised the age to 26, and 3 million people every year have access to insurance because of a simple choice like that. I think that bill, Mr. President, was 4 pages with lots of white space, and 3 million people get insurance every year that wouldn't have insurance otherwise, or at least traditionally hadn't had insurance otherwise, at no cost to taxpayers, and frankly not much cost to anybody, because those young, healthy people just establishing themselves, just leaving home, just going off mom and dad's insurance, thought they could get by without it for a while, and in all likelihood they were right. So they're not a hard group to insure, but that's the kind of thing we ought to think about, where we figure how to increase access to coverage without taxpayers having to bear the load for somebody else's health care if there's another way to do it. We want to be sure that whether it's keeping on your family insurance, staying on your family insurance longer, having no lifetime cap. That was a legitimate problem that many people face. They'd have their insurance, they'd pay for it forever, and then when they faced a catastrophic situation, at some point, the insurance companies in earlier times were able to say, you've reached your lifetime cap, and so we're now canceling your policy. That wouldn't happen under any plan we're discussing. The landscape for health care and what families and individuals has to deal with has dramatically changed, and because of that, it's going to be more challenging to go forward than it would have been if we'd have done the same half a dozen common sense things just a few years ago. This is no 2,700-page response or substitute for the 2,700-page Obamacare bill. This is a easily understood way to go forward that eliminates taxes that everybody's now paying on their health care. There's a medical device tax. There's an over-the-counter medication tax for things you don't have a prescription for. There's a special tax on those over-the-counter medicines in the current law. Those would be repealed. The medical device tax would be gone, would be phased out. The over-the-counter tax on medicines would be phased out. The tax on prescription drugs, by the way, Mr. President, if you buy over-the-counter, you pay a tax, but if you get a prescription, you also pay a tax. There may be a place in here where you pay a tax for just paying a tax. But the medical device tax gone, the over-the-counter medication tax gone, the tax on prescription drugs would be gone, the tax on health insurance policies would be gone. When you get health insurance, there's a tax to be paid under Obamacare on that as well. The Medicare tax increase would be gone. The tanning bed tax would be gone. The net investment tax would be gone. The health insurance tax would be gone. It's about $1 trillion in taxes that were added back into the system. And by the way, if you have some kind of coverage for a medical device, you're paying for the coverage, you're paying a tax on the coverage. If you're lucky enough that the medical device is covered, your insurance company pays that, and of course they pay the tax on that, and then you have paid it in the premium that you had to pay to cover the tax. We've got to step back here and try to do the right thing. My friend from Illinois earlier mentioned that there traditionally were 5 different ratings, community ratings of people of different ages based on the health care costs they might have. The Obamacare bill said, no, you can only have 3 ratings. The youngest, healthiest people can't pay they can't pay an amount that where the oldest, sickest, most likely to use health coverage can't pay more than 3 times what the people at the beginning of the insurance community pay. And another reason, if you're young and healthy, not to get insurance. Things that were put into this to raise cost for so many people. What happens? And then people say, well, why is it that we don't have enough people covered? They say, well, the real problem with Obamacare is there weren't enough young, healthy people that bought coverage on their own. It was designed into the plan to make it very unattractive if you're young and healthy to buy coverage, because suddenly coverage for that population was in relationship to all other people being covered higher than it had ever been before. We would restore with the bill the House is debating now the disproportionate share payments to inner city hospitals, to rural hospitals, where you treat more people who are either on a government program that doesn't pay very well, or more people who don't have any coverage at all. That was eliminated in Obamacare. We now realize that world is a world that doesn't exist, where everybody comes to the hospital, everybody goes to see the doctor, everybody seeks health care with coverage. And who takes care of that? This bill being debated right now in the House looks at that again and says, let's get back to where we're actually helping those institutions that are particularly focused on underserved populations. They're particularly focused on doing that. So we have an opportunity here, basically in 3 different steps, to do what needs to be done. And the first 2 steps are critical. One is to set an end date for the chaotic situation we're in now, to do as much as we can with budget tools to set a framework for how we move on and get out of these incredibly devastating budget situations for both the federal government and for families. The second is to let the Secretary of Health and Human Services, who was confirmed by the United States Senate just a few weeks ago, look at the over 1,400 times in Obamacare where that department can create regulations that either make it harder or make it easier for people to comply with the law. One of those, most important, is deciding what classifies, if you're an insurance company and you're offering a health care product, what classifies as an acceptable product. What is the basic criteria that you can have offer to people and still be offering health care insurance? So, Mr. President, we're at an important moment here. There is no doubt that the current situation is collapsing, that health care providers who provide health care to people that don't have coverage are not protected by programs that they were previously protected by. The people who used to have lots of choices in insurance, in many cases now, have only one choice, and it's not a choice they can afford. And when they do pay for it, they feel like they're living without insurance at all. So we're doing what needs to be done, and we have to do what we can do to get back to where people can have the insurance that they think meets their needs, the insurance they can afford, and see the doctor they want to see. A patient-centered system instead of a government-centered system is the answer here, and we have to get this job done, and I believe we will.